Right, back live tonight here on In Focus. Let's look at other news now, making headlines. As cases of Mpox rise globally, LGBTi plus activists have cautioned against the stigma linked to the disease. Mpox is a viral disease that spreads through physical contact, although not as rapidly as COVID-19. South Africa has reported 16 cases of Mpox, including 3 deaths. All patients are males aged between 23 and 43 years old. Newzroom Afrika's Karinda Jagmohan with us for more.
These are some of the derogatory messages floating across social media about the Mpox disease.
Particularly since our clients, MSM and gay men, already live a life of marginalization and stigmatization, it might be very unfair, to label Mpox as a gay disease, which it is not. It is not a gay disease.
It's not. The Mpox disease, which presents with rash and flu-like symptoms, can infect anyone who has close physical contact with an infected person. But the current global outbreak is seemingly more prevalent among males.
If we look specifically at what's happening or what has been happening within the context of the multi-country outbreak, it's more than 85% of cases that have been reported in males in the age group similar to the cases that we've been reporting here in South Africa. It requires direct skin-to-skin contact. So you can imagine somebody having the lesions and a person that's not infected yet and skin-to-skin contact.
3 people in South Africa have died from the disease linked to the current outbreak. While there's caution about the stigma, the Engage Men's Health Clinic is also training their clinicians about Mpox.
It's unfortunate. We're looking at the statistics at the moment, and the statistics shows that in terms of those individuals that had been affected and had been hospitalized or treated for Mpox, they are all men. But that being said, we also know in terms of the risk of contracting Mpox, any person can contract Mpox, and so we caution against the narrative that Mpox might be considered as a gay disease. But in terms of readiness, we believe that we are ready as an organization, as a health service provider. As I mentioned earlier, we have mobilized our partners within the different regions where we have a footprint. We have been in discussions with the Department of Health. In fact, earlier this morning, we convened a training session to make sure that all of our clinicians, all of our clinics that we have available is ready and able to receive and able to assist individuals who might be suspected of Mpox.
The group recently opened a new men's health clinic in Braamfontein for gay men and men who have sex with other men. This is their message as Mpox cases in South Africa reaches 16.
For now, the message is prevention, and if you do suspect yourself, come in and seek care.
The health department has advised that Mpox is preventable and manageable, but patients living with chronic diseases and with low immunity may be more at risk and should take extra precaution. For Newzroom Afrika on Channel 405, I'm Karinda Jagmohan in Johannesburg.